So, today we're going to break down a topic that you've probably heard of, but maybe don't know a lot about: esophageal cancer. I know, it sounds pretty intense, but the goal here is to make it all make sense. We're going to walk through what it is, what to look out for, and how doctors figure it out. Let's dive right in.
Okay, right off the bat, the most important thing to understand is that this disease has been going through a major shift. Seriously, the esophageal cancer that's most common today is not the same one that was most common a few decades ago.
And this is where the story gets really interesting. For a long time, one specific type of this cancer was the one you saw most often, all around the world. But that's completely flipped, especially in Western countries. And this isn't a random change, not at all. It's a huge clue that points directly to shifts in our lifestyles.
Meet the new front-runner, adenocarcinoma. Basically, it's a cancer that starts in the glands that produce mucus in your esophagus. And its rise has been, well, pretty staggering. It is now, by far, the most common type you'll find in places like the UK and the United States.
Yep, it has officially knocked the old champion, squamous cell carcinoma, off the top spot. And you have to understand, these aren't just two slightly different versions. They are two totally different diseases. And getting that difference is the key to understanding this whole thing.
So that brings us right here to the two main types of this cancer. You can almost think of them as two completely different paths, with different causes, different risk factors, the whole shebang.
So on one side, you've got adenocarcinoma, the one that's on the rise. And on the other, squamous cell carcinoma. Now, they both happen in the esophagus, but honestly, that's pretty much where the similarities end.
This table really lays it all out. Just look at the epidemiology, where it happens. Adenocarcinoma is a big deal in the UK and US, while squamous cell is way more common in the developing world. And their location is a dead giveaway. Adenocarcinoma almost always pops up in the lower third of the esophagus, right near the stomach. Squamous cell, that's usually in the upper two-thirds. And then you get to the risks, and they are just worlds apart. For adenocarcinoma, the biggest clue is right there in its location, so close to the stomach. It is very strongly linked to chronic acid reflux, or GORD. You know, heartburn. When that acid splashes up over and over for years, it can actually change the cells lining your esophagus. That condition is called Barrett's esophagus, and it's a huge risk factor. Then you throw obesity and smoking into the mix, and you can see why this type is becoming so much more common.
Okay, so we've got the types, we've got the risks, but how would anyone even know if something was wrong? Let's talk about the actual warning signs.
Now, out of all the possible symptoms, there is one that stands head and shoulders above the rest. It is the #1 reason someone with esophageal cancer goes to see their doctor for the first time. And that symptom is called dysphagia. It's just a medical term for having trouble swallowing. It can feel like food is getting stuck in your chest or just not going down right. This is, without a doubt, the single most common sign, and it's something you should never ignore.
Now, while dysphagia is #1, there are other red flags to be aware of. Things like losing your appetite and dropping weight without trying, that's a big one. Some people might experience vomiting or even odynophagia, which is when it hurts to swallow. That's different from just having difficulty. Oh, and see hoarseness on that list? A raspy voice can actually be a sign of a more advanced tumor up high in the esophagus, because it can affect the nerves that go to your vocal cords. All right, so let's say someone goes to the doctor with these symptoms. What happens next? Let's trace the journey from that first appointment to getting a full picture of what's going on.
So the whole thing kicks off with an endoscopy. A tiny camera goes down to take a look and, crucially, to grab a small tissue sample, a biopsy, to see if it's cancer. But here's the thing. Getting that, yes, it's cancer confirmation is really just the beginning. All these other steps you see here, they're all about one critical thing: staging.
And you might be thinking, whoa, that seems like a lot of scans and tests. Why so many steps? And that is a totally fair question. There's a really important reason for being this thorough.
It all comes down to staging. Staging isn't just about finding the cancer. It's about creating a detailed map of it. How deep has it grown? Has it reached any nearby lymph nodes? Has it traveled to other parts of the body? Answering those questions with things like ultrasounds and CT scans is absolutely essential to figuring out the best possible way to treat it.
Okay, we have covered a ton of ground here, from how this cancer is changing to how it's diagnosed, so let's boil it all down to the absolute must-know points. If you only remember 3 things from all of this, let it be these. First, that type of cancer linked to acid reflux, adenocarcinoma, is now the main one in the West. Second, the biggest warning sign, the one to really pay attention to, is dysphagia, trouble swallowing. And third, the diagnostic process is a careful marathon, not a sprint, because getting the staging right is everything.
At the end of the day, understanding this stuff isn't about being worried. It's about being aware. It turns that vague anxiety into useful knowledge. And being aware is always, always the most powerful first step you can take. Thanks for joining me for this breakdown.